intensified effort to keep Ebola out of the U.S. comes on the same day California's nurses filled the governor's office. We have live team coverage of the two major developments on the Ebola outbreak. Let's begin with KCRA3's Shara Kina Shams live from the state capitol with what the nurses are demanding and what the governor told them. Shara?
Yeah, Edie, the governor met with about 3 dozen nurses from all over the state who say that even 3 weeks after the first reported case of Ebola in the U.S., California hospitals are still not prepared to keep the illness from spreading. Nurses from all over California, some of them wearing buttons in support of 2 Dallas nurses who contracted Ebola after treating a patient, took their worries to Governor Jerry Brown. Lynn Tirona is a registered nurse at Kaiser Morse in Sacramento.
I have 2 small kids myself. I'm a mom, and I don't want to get contracted with Ebola and pass it on to my kids and my patients.
Tirona and other nurses say hospitals are not prepared for Ebola.
I heard someone say that we don't have to worry about it because nobody's coming to Napa because of the earthquake. And yet, it's the #1 destination point in the United States, wine country.
But in an interview with KCRA3 today, the president and CEO of the California Hospitals Association did not say hospitals are ready. Instead,
hospitals are getting prepared. Every state, even the Centers for Disease Control, are trying to catch up because Ebola is different than anything else we've faced. And California has to prepare for the transportation, for medical waste, for the treatment of patients after they have been screened and diagnosed.
Nurses say they want mandated requirements at California hospitals for both training and protective gear. They left Brown's office encouraged.
He listened to the nurses. He listened clearly to the nurses. They're moving forward, so they're in action mode to help us out.
Now, it's not yet clear specifically what action the governor may take as a result of today's meetings. We do know that his administration, especially the Department of Public Health, has been working overtime for weeks to urge hospitals to get ready for the possibility of Ebola in California. Now, nurses are demanding a specific type of protective gear. Tonight at 6, why the hospitals say getting that may be easier said than done. Live here at the state capitol, I'm Shara Kina Shams, KCRA3 News.
All right, Shara, thanks for that.